Hello everyone, welcome back to our YouTube channel Dr. MDMS. I am Dr. Saad and today I'll be discussing on a very important topic, that is monkeypox virus. So recently within a few weeks we have been seeing a spike in the number of monkeypox virus cases throughout the world, especially in the European countries such as Belgium, France, Italy, Germany, as well as Portugal, Spain and United States of America, United Kingdom, Canada and Australia. The World Health Organization has registered more than 200 cases of monkeypox virus. Fortunately, there is no case of monkeypox virus that has been registered in India at present. That's why there is an important need to educate ourselves about this disease and to know what are the causes, what are the symptoms, how is the transmission of the disease, and what are the preventive measures as well as treatment options that are available to prevent the monkeypox virus infection. So let's start our discussion in this video. The first case of monkeypox virus was found in a laboratory monkey in the year 1958, and later on in the year 1970 the first human case of monkeypox virus infection was registered in the Democratic Republic of Congo. So this monkeypox virus it's basically endemic to the Central African as well as the West African regions. And from the year 1970 onwards, this virus it spread throughout the world and it caused small outbreaks in different countries. But these outbreaks were of a limited proportion, and that's why there was no pandemic as such of monkeypox virus. Monkeypox virus basically belongs to a group of diseases that is known as viral zoonosis. Viral zoonosis is a group of diseases in which the infective agent, in this case the monkeypox virus, it is transmitted from animals to human beings. The monkeypox virus is commonly seen in animal hosts like tree squirrels, rope squirrels, Gambian pouched rats, dormices, and it is also seen in many species of the monkeys. So let us know about the virus. This virus is a double-stranded DNA virus and it has two variants or two clades as we term it in medical terminology. So there is a Central African or a Congo Basin clade, and then there is a West African clade. So it is so many studies have been done, and these studies suggest that the Central African or the Congo Basin clade is more infectious as compared to the West African clade. It is also important to note that the Central African clade variant has caused severe infection in the past. So now let us know how the monkeypox virus is transmitted to human beings. So basically there are two modes of transmission of monkeypox virus. Firstly, there is an animal to human transmission, in which whenever a healthy human he comes into contact with an infected animal, then through the respiratory secretions, through blood or through body fluids, through the skin lesions which the animal has during monkeypox virus infection, or through actively infected or through the recently infected objects, the monkeypox virus can spread to a healthy human being. Secondly, there is human to human transmission, in which due to close contact with an infected human, due to respiratory secretions, due to blood, due to body fluids, as well as due to recently infected objects, the monkeypox virus can spread to a healthy human being. It is also important and concerning that the monkeypox virus can spread from a mother to her fetus. So women who are pregnant should take extra precautions so that there is no transplacental spread to the fetus, so that congenital monkeypox virus infection is prevented. So what are the symptoms and signs that we see in a monkeypox virus infection? So first of all, there is an incubation period. That means the period in which the virus resides in the body without causing any symptoms. So this period is usually from 6 to 13 days, in which the monkeypox virus grows in the human body and later on it causes symptoms in the human body. So firstly, there is high-grade fever, followed by muscle ache and body ache. There is intense asthenia, that means there is intense lack of energy, as well as there is headache and body ache. A very important feature that is seen in monkeypox virus is lymphadenopathy, that is swelling of the lymph nodes. So this feature is distinctive and it is characteristically seen in monkeypox virus infection, and it helps in differentiating it from other pox virus as well as other infections that cause skin lesion. There is a specific skin rash which develops in the monkeypox virus infection within 1 to 3 days of fever. This skin rash is characterized by 4 stages, that is the macular stage, papular stage, pustular stage and crust stage. So in pustular stage, the skin lesion is characterized by development of fluid-filled vesicles, and these fluid-filled vesicles are infective and they can cause spread of the infection to a healthy human being. This rash, it can develop over the extremities of the body, including the arms and the forearms as well as the face, and it can also cause rashes on the trunk, that is the body, the chest, abdomen as well as the back. The number of the skin lesions can vary from 5 to 1000. And apart from the skin, the conjunctiva, the cornea, the oral mucous membrane as well as the genitalia can be affected due to this. Now let's talk about the course of the disease. Usually monkeypox virus is a self-limiting disease, and within 2 to 4 weeks the symptoms as well as the signs, that is the rash, they subside on its own. The complication that can arise due to monkeypox virus infection. So firstly, there can be secondary bacterial infection, there can be sepsis, there can be encephalitis, also there can be bronchopneumonia, and there can be loss of vision due to corneal or conjunctival ulceration because of the rash involving the conjunctiva or the cornea. It is also important to note that monkeypox virus infection can lead to severe disease in children, especially those children that have a poor health status, in whom the immunity is compromised or who have a greater exposure to the virus. Now coming to the case fatality ratio. Case fatality ratio basically means that if there are 100 people who are infected with the monkeypox virus, then there are chances that 0 to 11% of the people can have fatal disease and fatal outcome. And this case fatality ratio is even more in children, hence we should take extra precautions whenever a child gets infected because of the monkeypox virus infection. Now what are the ways in which we can do the diagnosis of monkeypox virus infection? So there is PCR testing available, that is the polymerase chain reaction testing, in which the lesions of the skin, they can be sampled to find out whether it contains monkeypox virus or not. And on testing positive, it is confirmatory that the individual has got monkeypox virus. Now coming to the treatment part. The treatment of monkeypox virus is usually supportive care and preventing the secondary bacterial infection that might arise. So this care, it includes giving the patient intravenous fluid, maintaining a good and healthy diet, as well as giving antipyretics and broad spectrum antibiotics to cover the bacterial infections. The US FDA has approved 3 medications or 3 drugs for the treatment if there is a monkeypox virus outbreak in the community. These 3 drugs or medications, they include tecovirimat, cidofovir as well as vaccinia immunoglobulin. Now coming to the vaccination options, it's a very interesting fact which everyone should know, that smallpox vaccine has been found in many studies to be 85% effective against preventing the monkeypox virus infection. Since the monkeypox virus as well as the smallpox, they belong to the common family of poxviridae, hence they show a cross protection against each other when vaccinated. Therefore, individuals who were vaccinated or who are vaccinated against the smallpox virus, they have very less likely possibility to develop the monkeypox virus infection, as well as the severity of the infection will be less in these individuals. In 2019, there is a newer vaccine that has been approved against the monkeypox virus infection. This vaccine is known as the modified attenuated vaccinia virus vaccine, which belongs to the Ankara strain of viruses. 2 doses of this vaccine are given, but unfortunately the availability and supply of this vaccine is limited at present in the world. Now coming to the most important topic of discussion, that is how to prevent monkeypox virus infection and how to prevent its spread in the community. As per the World Health Organization, during an outbreak of monkeypox virus infection, close contact with an infected individual is the most important and most significant risk factor for the spread of the disease. Hence, it is very important for us to educate ourselves about the disease as well as to know the signs and symptoms that occur in the infection, and to take early preventive measures as well as early care and immediate treatment to prevent the spread of the disease. Avoiding close contact with an infected individual is very important to prevent the spread of monkeypox virus infection. If we find an individual or an animal who is infected and who shows symptoms of the monkeypox virus infection, then we should take care that while approaching such patients, we should take precautionary measures including hand sanitization, wearing of gloves, wearing of masks, as well as the preventive goggles. We can also use personal protective equipment. Coming to the last part of our discussion, I would like to say that spreading awareness about the disease in the society, as well as educating the people about the signs and symptoms and its treatment option, as well as taking early preventive measures, are the most important factor that can help in preventing the spread of any such outbreak in the future. If you found this information useful, then please forward this information and this video to your friends as well as your family. Do like, share and subscribe to our channel for more such useful videos and informative and health related videos. So stay happy, stay healthy, stay blessed and take care.